right, everybody, please state your name and who you are, and the recording has started.
Good morning. Thank you for attending. My name is Harrison Pierce. I'm the Chairman of Health and Human Services Commission. Let's get to our work at hand. First item on the agenda is the approval of the January 6th minutes. And any questions, corrections? May I have a motion to approve?
I so move.
Second,
Second.
all in favor? Aye.
Aye.
Thank you. Next item, we're going to go to reports, but before we get there, I just want to mention that Jen and Bethany gave excellent and very comprehensive presentations of the budget, etc., to the town council, and that is available for your viewing. Not going to mandate it because that's not a popular word these days, but we're going to, I would suggest that you tune in. You can get it on the town council video site, and also it's on YouTube. And thank you. Next now, so we'll go to reports, and Jen Eielson, Director of Town Health. Jen, are you on?
I do not see her, Harrison.
Okay, we're going to. Okay, we'll move to Human Services Department with Bethany Zarrow.
Hi, everybody. Bethany Zarrow, Director for New Canaan Human Services. I'll go through the items for this month that we're working on. First of all, the budget season is in gear. And as Harrison said, the presentations are on New Canaan YouTube or the town council or the website for the Board of Selectmen. And so I've given the presentation both to the town council liaisons and to the Board of Selectmen, waiting to hear back in terms as it moves forward through the season. Food pantry, we've got our continued numbers happening. We see a decrease in donations, but that's very seasonal. We had an unbelievable winter holiday Christmas time. And so that is going as usual. And we are definitely fortified with food and monetary donations to get us through. Osha Training, we've started our Osha Training. That's the Occupational Safety and Health Association. And every year departments are mandated to have training for bloodborne pathogens. So I do that. We started with the fire department. This month we'll be doing public works, which includes parks, highway, transfer station, and wastewater. And we'll be giving them their annual refresher courses on bloodborne pathogens. I'm continuing the blood pressure clinics at Lapham and Schoolhouse. And let me see, COVID update, Office of Emergency Management passed out at-home test kits. We received 250 of them. We have about 10 left. The public donated their kits to Human Services, and we've offered them to seniors or anybody that does call needing them, as well as we've directed them to the website where you can sign up for the 4 free test kits per family through the state and federal programs. All right, well, employee wellness initiatives. We have Stretch Lab. We've coming on February 11th with 2 reflexologists for our employees to have a 15-minute session with a reflexologist. And so that's been very well received with the input and people signing up on Sign Up Genius for their time. The partnering efforts that have been going on, I continue with the small town director meetings every 2 weeks. And it's between, there are 9 to 10 directors from Greenwich all the way to Easton, Westport, Reading, and we just definitely back and forth with conversations and trends that we see in our area. And so this area definitely where the directors are all seeing the same trends in terms of domestic violence, behavioral health, and other things, which Jackie and Marcy will go into with their work. We do have a woman who is starting a nonprofit, Repurposing Flowers. And so she has partnered with us, and now we're delivering when asked, or they're delivering, but we do call some of the vulnerable and isolated population if they would like to receive a nice flower arrangement. And so there is the initiative for isolation purposes, coming to people's houses and dropping off something, forming relationships with other residents. The United Way has graciously, generously given New Canaan Human Services $2,000 to go towards the food pantry, as well as 500 N95 masks. And we've been passing those out with the at-home test kits, COVID test kits. That's gone very well. United Way, we have a great relationship with them. Laurel House and Voices, we are working with them in terms of resources and understanding what is involved and what they can offer to New Canaan residents. And so they're getting on our radar, and we are definitely sending people in need of help that possibly they can offer. The director of Elder House in Norwalk contacted me last week regarding residents in New Canaan that want to attend their adult daycare program, but there's no transportation for them. So I've been in touch with Get About, and we had a meeting yesterday with the director of Laurel House, Denise Cesario, as well as Bill Post, the chair of the Get About, and myself. And
No, I mean, for yourself, to mute me.
hi, Jen. And we are going to be working out transportation to the Elder House to help relieve respite care for the caregivers, as well as decreasing isolation for the senior or disabled, that it needs to have some more active activity in their life. So this was phenomenal. This is great. NCL is in touch with us. They're doing charity projects for the homebound as well. And Jackie and Marcy will go into the case management. Other than that, we just continue working with police. The partnering has been incredible. So I'm going to take it away to the caseworkers. And once again, they've been working nonstop, and just hopefully we're making differences in people's lives and with the resources we're providing. That's it, Harrison.
Thank you, Bethany. Question, the reflexologists, do they go to the individual areas, or do you do it at Waveney, or where?
No, so it's going to be at Town Hall in the large meeting room. There was such a positive response at the employee wellness fair that we had in October. So they're back by popular demand. So this is something that we wanted to do. And HR agreed. And so we're relaxing, giving some relaxation to the employees.
Sounds good. Very nice.
Yeah.
The elder care, so what's the frequency of the visits?
So elder care is Monday through Friday. Most people do Monday, Wednesday, Friday, or Tuesday, Thursday. And it is, Elder House is only adult daycare program. They focus on that. Get About feels that they can take up to 5 residents for their weekly participation. Anything more than that, we have to discuss. But this is also one of the reasons for the ARPA funds, which makes even more sense to get requesting another van so that we can provide this program to those in New Canaan.
Thank you, Bethany. Hello, Jen. You look a little different than Enza, but we recognize you. And it's good you're still with us. So Jen, let's turn this back. We'll go to the Health Department with Jen Eielson.
Yeah, sorry, we had connection issues at Vine, so I'm in Enza's office. So I'm
Speak to the
Jen
first
Eielson.
selectman about upgrading it there.
So I'm Jen Eielson, the Director of Health for the record. We'll start, like always, with vaccine update. DPH data as of January 27, 2022. They've now added booster data to it, so we'll go through all three doses. Age range 5 to 11, well, with one dose, 69.35%. 2 doses, fully vaccinated, 58.81%. Booster is obviously NA, it hasn't even been 5 months yet. 12 to 17, we're at 100% with 1 dose. 98.2% with 2 doses, fully vaxxed. With the booster additional dose, they're at 47.44%, which even though that seems low, that's actually the highest in Connecticut. 18 to 24, we're at 100% with 1 dose, 100% with 2 doses, and 49.43% with booster. 25 to 44, 100% 1 dose, 100% 2 doses, and 56.28% with the booster. 45 to 64, 97.84%, 87.28% for 2 doses, and 56.25% for booster. 65 and over, 100% with 1 dose, 99.9 with 2 doses, and 72.35% for the boosters. So even in the senior 65 and over, the uptake on boosters statewide has not been quite as expected. Total population fully vaccinated is 86.62%. Just to clarify, because I got a lot of questions on the alcohol last week about fully vaccinated, CDC has not changed their definition. 2 doses is still fully vaccinated. So that's still considered the definition of fully vaccinated. The booster is what CDC is calling stay up to date campaign. So, but they haven't officially changed the definition. Percent of total population with booster or an additional dose is 47.28%. The health department has administered 22,701 doses to date. On January 12th, we partnered with the New Canaan Public Schools to host a booster clinic for ages 12 to 17 at New Canaan High School. We did a total of 651 that night. We did have over 200 canceled due to illness, not just COVID, cold, flu, whatever, and sporting events that night. But still, we did a large number that night, so that was a great turnout. The health department continues weekly booster clinics at Irwin Park. We have another one today, and hosting pediatric clinics for the 5 to 11-year-olds at Vine Cottage. We did one on Tuesday night, and we'll have another one next week. Shannon has been reaching out, calling all our homebound vaccination lists to offer them homebound booster dose vaccinations. So she's been working on that with our nurses. We also just started reaching out to the restaurants and salons and businesses that we did over the summer, because now they're due for booster doses as well. And we will do the same like we did last time, go into their establishments and vaccinate them on the spot. Some updates from DPH. Moderna has been granted full FDA approval. That's obviously ages 18 and over. It will be known commercially as Spikevax. Novavax, which is a protein-based vaccine, so it's different than the mRNA, has submitted for FDA EUA approval. That is also a 2-dose vaccine taken 21 days apart. DPH has also told local health and all COVID vaccine providers to begin preparation for vaccinating 6-month-old to 4-year-olds. Pfizer submitted to FDA for EUA approval of the 2-dose, not the 3-dose regimen. They are meeting on February 15th with the FDA and the various agencies to have that discussion. So they're thinking early March to be ready for that. Testing, PCR testing with SEMA4 ended on January 15th. As everyone knows, SEMA4 has left COVID-19 testing in Connecticut. The total tests done with SEMA4 and Waveney from August 2021 to January 13th were 1,878 tests for 4.66 positivity rate. On the 19th, we began with Progressive Diagnostics, a new lab. They're located in Trumbull, but the courier, we just go to Norwalk for them. That's now 3 days a week, Monday, Wednesday, Friday. The results are that night. So to date, we've done in the 2 weeks, 284 tests, 29 positive for 10.21% positivity rate. Of note, the ones all tested yesterday were negative. So that is a good sign. We're heading in the right direction. Rapid testing has declined, especially obviously with home tests, but we to date have conducted 1,363 rapid tests, 158 positive for 11.59% positivity rate. But I will note, most of those that are testing for rapid are symptomatic. So that should be a relatively higher positivity rate. The health department has a small supply of home tests from the state for vulnerable populations. So those we've been, again, when we do the homebound vaccinations, we offer it to the homebound. Schoolhouse Apartments has taken some, and any other residents that reach out that, you know, are in need and are part of the vulnerable population. Next, the Community Health Improvement Plan, otherwise known as the CHIP plan. That is a state requirement for local health. And we are partnered with Norwalk Hospital on it. We just did this 3 years ago, and with the pandemic, now it's ready to go yet again. So we had our first meeting 2 weeks ago with Norwalk Hospital with the community health team. So that's made up of New Canaan Health Department, Norwalk Health Department, Westport Weston, which is actually now known as Aspetuck Health District because they've added Easton, AmeriCares, Fairfield County Community Foundation, Norwalk Hospital, and the Hub. The CHIP plan helps identify the key areas that will be focused on, and Norwalk Hospital receives grants from DPH to lead this effort. The top 3 priorities in the region are mental health, number 1, number 2, behavioral health / substance misuse, and 3 is food insecurity. So that will be a plan with the subgroups that we go through and work on developing the CHIP plan as outlined by the state. I'm also on the State Health Improvement Plan Committee, one of only 3 health directors in the state. So I'm heavily involved in that side of the process as well. Because, you know, even though we did this 3 years ago, a lot of the same issues are still number 1. You know, mental health was an issue beforehand, and now it's obviously been exacerbated by the pandemic. And substance misuse has been exacerbated by the pandemic and isolation and opioid overdoses. Environmental health updates. Chris is working with 2 potential new businesses coming in at the old Subway location for a food establishment, in the old Garlic and Herbs for another food establishment. He's in the early phases of going through the process with them and how it works with us, P&Z, fire and building. There's also a new salon Chris is working with that's going to be coming in at 64 Main Street, which is good news. We like to see development. Chris is also handling the dust wipe samples of lead abatement projects that are being closed out. The last 2 weeks, we've been kind of sidetracked with the frost and the snow. So now with the septic soil testing and installs are behind schedule because of that. So hopefully we'll get through that with better weather. And finally, the health department presented their budget to BOS last week. Many of you were on the pre-meeting on Tuesday that we had. The only major change to the health department budget is a capital request for 2 vehicles, because we only have 1 and it needs to be replaced. And that's the next step of the process is a Board of Finance next Thursday night. So that's where we're at.
Oh, Jen,
Thank you, Jen.
Jen, I had a question, and I commend you on a very thorough and a concise report there. Why do you think we're kind of slow on the uptake for the boosters? I mean, we did great with the first two, and we seem to be a little lax on getting boosted. Even the 65 plus population, where I would, that's so highly advised. Yeah, any thoughts on that? And
I think part of the problem, Tom, is the not clear communication coming from the CDC created a lot of confusion in the beginning. We were doing booster doses back in September when it first came out, but the way they rolled it out and you had to be immune compromised or blah, blah, blah. And then they changed it in midstream. And then in December, when there was such a crush and it was, so hard to get appointments again, it, frustrated people. And when something's, the 2 doses were required, in order to meet these, go into New York City or do some travel things, the booster is not at that point yet.
So you think people say it's kind of elective and maybe not, so why bother? And I don't have to do it, so I won't. Is that something like that?
It kind of seems, I mean, I'll admit, even I was, slow to get my booster when it first came out because, I did it in December, luckily in the nick of time before my other staff members tested positive. So, everybody just has a different, but that's why it's with the school, like the 12 to 17-year-old age range. If you look at the data, all this is public data on the state website. I mean, you have municipalities like Bridgeport that are less than 5%.
Wow.
So, and then you have New Canaan, that's the highest in the state at 47.44%. So even though that's low for us, we're used to 90s, hundreds. In the scope of things, it's actually high. And the same thing with the kids, the pediatric uptake. If you look at the data in the state, most are hovering in the 30s to 40%. And that's what the CDC and FDA had predicted, that 35% to 45% range. And New Canaan's actually, at almost 70% with that age group. We don't know what's going to happen with the 6-month-olds to the 4-year-olds. That's not really mass vaccination. That's, we'll be taking a whole hour in our, office with our pediatric nurses from New Canaan Pediatrics that work for me to do these clinics and have the nurses being able there to answer all the questions of the parents, take the time, because as you get younger and younger with the kids, it's not in and out. It's, sometimes a fight.
Yes. The other question I had, maybe on the hospital side, what's the data on boosted people having to go to the hospital? I know that we report fully vaccinated people, how many of them are in the hospital? And
there's actually on the CDC website a really good chart that shows unvaccinated, 2 doses, and then boosted, and it really breaks it down that you still have very good protection with the 2 doses, but it shows how much more with the 3rd dose you are protected. The problem with Connecticut is they don't give you that granular data that we all want. All we know is how many people are in the hospital. We don't know the age. We don't know anything. What their underlying conditions are. Are they there because they're in a car accident and they tested positive for COVID? Or are they in for COVID and on a ventilator? That's not where New York, it's beginning to get down to more granular of who actually is in the hospital because of COVID.
We need that. So, okay.
Yeah, we do. And I think everybody's been asking for it for a long time. And we still are not getting it. I mean, I am fortunate to get Dr. Reed's input from Stanford Hospital. So I do know granular data of Stanford Hospital, which is always nice to see.
How are the local hospitals doing now? Last month they had a lot of people in. I just wonder how we're.
No, it's dropped significantly, even statewide. We were down 400 last week from the week before. We're down another 400 this week. We're under 1,000 now statewide.
Great.
So it is good, trending in the right direction. I mean, obviously, COVID ebbs and flows. It keeps going in waves. We don't know what's going to happen next. Everybody can guess, but we just don't know.
I'll give you the update on Norwalk. So as of the end of last week, they had 24 COVID patients in the hospital. Their peak this year was 52. And if you turn it back to, a year plus ago, it was 100 plus being hospitalized. There are presently 6 people in the ICU, all on ventilators. One has been fully vaccinated and boosted. Did not go into details as to predisposing conditions, age, et cetera. The director of medicine said, so, the numbers are going in the right direction, but quote, we're not out of the woods yet, unquote. And the 99% of what they're seeing is Omicron, and it is less virulent, but not with all, obviously, with those numbers in the ICU. I know Stanford Hospital has had no ICU admissions with COVID in the last couple of weeks. Like Tom, I was curious about what's going on with our 65-year-old plus population, because the print, the computer, the television are full of information about how important the boostering is. And I thought, what more can we do in New Canaan? Well, Shannon's on the phone, I guess, getting the homebound. Jen, should we contact those who are just in that age group and not boosted, or is that infringement on privacy, et cetera?
I would have to talk to the town attorney about that before we
Right.
attempt
I mean-
anything like that.
Look, I think there's two things. And first, Jen, thanks for your report and thanks for everything that you're doing. I know it's very time consuming, but we greatly appreciate it as a town and a community. I think the first thing is there's a lot of confusion over when a booster is necessary and required. So I get a lot of calls, even from family members with children. If they had COVID, 3 weeks ago, when can they get boosted? For a senior, if they had COVID, when is the right time to get boosted? They've had the first booster, they want a second booster, when's the right time? So I agree with you, there's a lot of confusion out there on when is the right time to get boosted and when should the second booster happen? Should you mix match your vaccination? So I think we as a commission, if we could put together maybe a policy or a statement to help take some of that confusion out of that, I think that would help the senior population. At Waveney, of course, we got it to 100% compliance, but we also have to have 100% compliance of the booster vaccine by February 11th. That was the last executive order that has come down. With all these health committees, with all the health committees that you sit on, with so many people doing home testing now instead of going through and getting a formal test, do we have any idea? I know the percentages have gone up a little bit from where they were, but do we have any idea what those numbers may be? And are people reporting if they do have positive tests to you?
Yeah, actually, I'm glad you brought that up because in the out call, there's a Google Doc that's created and we request people to report. So I downloaded the Google Drive again on Tuesday to see where we're at. And from the 2 weeks that I've created the Google Doc, there was 114 responses. And in the Google Doc, it asks, are you vaccinated with 1 dose, 2 doses, boosted? It gets into the granular. Now of note, around 40% were boosted that had tested positive, but that same group also reported either asymptomatic or minor symptoms. So good news, bad news is, bad news, they tested positive, but good news is the booster clearly worked, that they have such minor symptoms. And from that also, they were reporting of, there's no hospitalizations reported of that, of self-reporting, I should say. So we did have 114 responses, and I did find it interesting, the booster part of the data.
Thank you, Jen, and it's congratulations on the appointment to the state, another committee. It's good to, something else to fill the blanks in your schedule.
You're a funny guy, Harrison.
Let's see, next, Adult and Senior Services, Marcy.
Good morning, everyone. Marcy Rand, the Adult and Senior Services Coordinator. I I have been working more on some community outreach. I met with Julia Ray at the library along with Officer Bartuli, our community interaction officer here. We are going to try to start to plan sort of a mobile library for Canaan Parish and Millport and Schoolhouse. A lot of the books that are still bestsellers but slightly older have like a 2-month takeout period. So, we're going to try to do something like every 2 months. So no one has to, worry about returning. They can return and take out during this mobile library. And it's going to be great for the homebound and the seniors who can't get to the library. We are also, the fire department was nice enough to reach out and offer to do carbon monoxide and fire detecting installation in senior and homebound homes. So I am going to start going down our vulnerable population list and offering that. And anyone who's interested, we will schedule an installation date with the fire department. So we are grateful for that. I'm continuing to receive adult protective services cases. They are primarily behavioral and mental health cases. One in particular, we are extremely grateful to Dr. Gerber in Silver Hill. They've been amazing. We had a resident who was in need of mental health help and a bed, and Silver Hill got him a bed within 2 hours, and that was outstanding. And we are extremely grateful to Silver Hill, and we love the partnership that we have built. Our coffee with a cop will be next week at Lapham, and we are going to start a pizza with the police at Schoolhouse. A number of the police officers have mentioned to us that they actually don't know the Schoolhouse residents as well as they feel like they should. They are neighbors, and so we're going to have the police visit over there as well. And let me see, what else do I have to tell you? We have a few more energy assistance cases this year, and I think that next year we will have even more. Canaan Parish in their rent no longer includes heat, and heat now is being provided by natural gas and Eversource. So those bills have increased, and I don't know if they were anticipated or not. So we are now getting some energy assistance requests for Canaan Parish. And I think that's it. Yeah.
Marcy, how many people would you say are homebound in the town? Do we have an idea of the number of people in that category?
We have a combined homebound and vulnerable population list, and Bethany can correct me if I'm wrong, but it's around 165 individuals that we reach out to.
Wow.
Yeah, we'll always take more. We do hear more and more, and then put them on the list at their request, or so it is. We're always looking and hoping neighbors, residents call, and definitely it's a very fluid list, and we keep up with it in terms of if someone has passed or moved away, but it's definitely a very important source for our outreach.
Yeah, it is absolutely like a live list. I know that if that we have a great relationship with the police and the EMS, and if there's a concern there, they will reach out to us as well. So the list is just, like Bethany said, very fluid.
Thank you.
Mm-hmm.
Thank you, Marcy. Jackie, Youth and Family Services.
Yes, hi, I'm Jacqueline DeLuey. I'm the Youth and Family Services Coordinator for the town. And it's nice to see everyone today. Hopefully we can meet in person at some time. So just some interesting sources of referrals for us. Obviously we get, the police are always a referral, like since the new year, I've had 2 where there have been minors. Like I interface with the police when there are domestic disputes, as you all know, but with minors since the new year. So that's great. And those are obvious ones, but I've gotten several more from the churches. So, it's just another way that we're connecting. They know who we are and they're meeting with a family, and then they, realize it's valuable for them to connect with us. But two I've gotten from the new year as well is the Community Action Agency of Western Connecticut is who we refer who we certify our fuel assistance clients with. They have funding sources. They do a various amount of things. They have a location in Norwalk, Stamford, and Danbury. But I have such a good relationship with one of the case managers there. She actually referred two families back to me that called her for either funding or, so it's just a great way to show you how, we can hear about more people and they're getting the help that they need. Still working on an outreach for a family that needed help with benefits and weren't aware of sort of what their options would be. So that will probably be just an ongoing that they wouldn't necessarily maybe get added to our case management system, but they'll just be someone I kind of consult with to help them with things going forward. I had 2 DV reports in January and it's only February 3rd. I've had one already for February. Some gaps I'm noticing, and I'm looking into ways that we can fill this, but there's a huge need for a divorce support group. I mean, I'm interfacing more with moms in this situation, but I'm sure there are dads out there as well. I know when I started many years ago, I think there was one at St. A's. People have mentioned there was one at the Congregational, but these things have kind of, dried up. I did find a resource that just started in Darien, which is great. It's at Norotan Presbyterian, and I've just referred 3 people in the last few weeks, but I'd love to see one here in New Canaan. The DVCC their Domestic Violence Crisis Center is looking to bring someone on there. They need a social work position, and they would offer this as well, which they're working day in and day out with these clients, but they're having trouble finding people to hire. So we're going to see if we can get a resume on Facebook Moms to see if, maybe there is someone that hasn't been working, mom maybe has that degree and would want to do this. So hopefully we can do that. But if anyone has any other ideas on how they can find someone, but they're not the only one I've been hearing from. I know that family centers also used to run a group. I've needed some teens that are experiencing substance abusing parents and they'd like support, and certainly Alateen is wonderful. I think kids don't feel super comfortable maybe going in person if it's in New Canaan. But they used to have a group at a family centers and they said if they could get some staff back, that maybe that could be something that they, revisit. So it's just kind of, frustrating to hear that these programs aren't being offered because we can't find staff to run them. But definitely that divorce support, I think if anyone has any other options, I'd love for a local church to offer something like that. Obviously those positions are volunteer based. The other thing is, if anyone knows Robert Curry, it hasn't started yet, but he is working with some people in the community on a women's empowerment, which would help women maybe going through divorce, financial. This could absorb maybe some of those clients. It would have a full-time social worker. I know he's paired up with Karen Nissenson. If any of you recognize her name, she used to run Arts for Healing here in New Canaan. And then I think Pamela George is going to be the executive director. What was nice is he did say, he might be able to offer this program for free or a sliding scale. That would be wonderful. So I hope that gets up and running soon, because I definitely think the moms I've come across could really benefit from this. One other person I invited, Greg Sloan. Oh, yep.
Yeah, Jackie, I didn't mean to interrupt you before you went on. There is a church council that has the ministers of each of the denominations within New Canaan that meet on a pretty regular basis, and Waveney
yeah, I'm familiar.
Has about 3 ministers that serve on that council. So I have no problem with asking them if they want to bring that up and then get back to you and see how maybe collaboratively they could work together on setting up some kind of support group for divorcees. And
yes, that would be great, because even if there were more than one, I definitely think then we'd probably have more people that would feel comfortable going to those. Like it would be a good problem to have, if a couple of them, were willing to do that, that'd be great.
Yeah, I'm just looking at it from a non-denominational,
you.
they're all working together and maybe that's a way of addressing it, but I'll ask them to bring it up and then get back to you if that's okay.
Russ, is this Interfaith
Yeah,
Council?
perfect. Thank you.
Yes.
Yeah, Interfaith. Yeah, great. Thank you.
Jackie, this
And
also,
then the other thing, I just
issues
had
of-
one last, oh, go ahead.
oh, sorry, this has come up on New Canaan Moms before, the idea of a support group for divorced moms. In particular, one of the women on New Canaan Moms is a financial expert that works with, in particular, divorced women on getting their finances in order. So I'm happy to get you in touch with her
Yeah,
and
please.
and connect you to and figure out a plan.
Sure.
You know,
that'd be
it's
great.
Penny. Russ was bringing up the ministers. Bethany, I think it's different than the Interfaith Council. That is representatives from the congregations that meet as a council. What Russ is talking about is the ministers themselves have a monthly meeting. So it's the professional ones, not, members of the congregation.
Got it. Thank you.
And then I had invited Greg Sloan. He's our teen talk counselor at New Canaan High. He works for Kids in Crisis. He started, I want to say he's maybe 2, possibly onto his 3rd month there to join us just for a few minutes at the March 3rd meeting. So I'm excited for everyone to meet him. He actually he had 2 high school seniors approach him concerned about their peers' mental health. So he's the advisor. They started a mental health club. So we can talk a little bit about that. And these kids really wanted to see, their peers that are struggling with any issues to have a positive experience and how they can help support them. If anyone has access to the article in the New Canaan High School Courant, they also had an article about it recently. He did send me one in our office and I have not received it yet. So if I do get it in my hands, I can scan it and share it with you guys if you haven't seen it. But this is one thing that I love. And it obviously, if students are driving it, then it's so important. Their peers will definitely listen in way more than they would to adults. The one thing that concerns me is when these seniors graduate, but hopefully there are kids under that grade that maybe could take it over. And I think, I also am working with the guidance counselor over at New Canaan High School, one that's brand new. I think she might have started last year, but she's been great and, connecting me with any family that has issues. And one of the things I was saying was, teens with substance abusing parents, just, that's such an important issue. But I also think maybe that kid can get connected with Greg Sloan's mental health club, because that's also going to support the child. Maybe just an individual counselor. It doesn't have to be, if we can't find the exact group. Although Alateen, there aren't any active groups here in New Canaan. I did research that. I remember, I think St. Mark's had one, and years ago, I just don't think it was well attended. And maybe that was the kids were worried about stigma, that could be the issue, but they're a Zoom generation. So that's fantastic for them to be able to tap in that way. So I'm excited, to have those resources. If anyone, I appreciate all of your help in regards to, anything with the churches for the divorce support and that financial contact. Alicia, maybe she'd be someone that would even want to work with like Robert Curry's group at some point. So this sounds great. Thank you so much. I appreciate that.
Thank you, Jackie. You, as Marcy, Bethany, you're all doing so much. And thank you for mentioning Greg Sloan. We will put him on the agenda for next month. It's a good thought to meet him and interact with him somewhat. So move to old business, COVID and mental health. Last week, one of the attendees mentioned and was questioning about lack of education or information regarding COVID and mental health for the youth, for families, et cetera. I was a little surprised at that. And I think, questioning what HHS had done, and we provided speakers, et cetera. I think Jackie did answer a number of those questions. And mentioned all the ongoing information sessions, lectures that the town has had. But it did raise the question, or is it not enough? Is it not being publicized enough, et cetera? And so question, and Jim Lisher mentioned about the series, Mind and Body Navigating, where he's dealt with a number of issues. And granted, maybe the anxiety, depression, et cetera, that was more prevalent related to COVID a year to two ago has diminished somewhat now, but is still out there. Is there need for more info in the community regarding this, or have we all been saturated? Not that the problem's going away totally, but it is ameliorating somewhat. And just throw that out for you.
Assuming I'm unmuted, I could add some content to that. Basically, I've been looking for, after the meeting and before that, ways that the commission should get involved and can get involved in the mental health side. Met with Kim Norton, our new advisor from the town council, who happens to be a PhD psychologist and practicing professional, about what to do in the future. And after that conversation, we decided we definitely would want to get a group together to talk about the long COVID implications of mental health. But you may recall this program of 6 programs that we put together under the commission and funded by the Jenian Foundation in the early part of 2020, ran in the fall. And then it was picked up in January by the Let's Talk About It community operation, which is focused primarily, as I see it, on adults and the family adults, I'll get it in a minute, family adults and children, rather than seniors. Our Mind and Body connection was originally focused heavily on seniors. So there's a need to go back and think about that. However, so Channel 79 was going to put this on next week, actually, and rerun the series. After talking about it and looking at it, that data which is the good news. 18 months ago, there was a lot of things going on that we covered in that navigating series that have changed. There was no vaccine back then, which is hard to believe. Anyway, the net of it is a lot of things have changed, so we are not going to rerun with major marketing and merchandising, as it were, to the community, the Mind and Body series, but there's a need to do something. And my suggestion, at least, is that the commission should provide something that, in addition to the Let's Talk About It program, focuses on seniors and adults. And from that standpoint, the specific thing that I talked to Bob Dorn about at 79 is running a panel, I guess I'll call it, for lack of something better, with Harrison and with Dr. Gerber, who did a small piece of a podcast for the Let's Talk About It. But that was a 4-person thing, and there was a lot of opportunity to add from Harrison and Dr. Gerber the things that would be more interesting to older adults. So one of the things I'm going to suggest that we consider as a commission is having a Channel 79 panel with Harrison and Dr. Gerber talking about mental health implications for the long term. That's first recommendation. Second recommendation is, after my conversation with Ms. Norton, we want to talk about the long COVID, which is the term they use for long COVID for medical ramifications of having COVID, but mentally, there's a lot that's going with it also. And so we want to talk about things like happiness and long-term navigation. There was an article yesterday in the Wall Street Journal saying, here's how to tackle pandemic fatigue. So from the standpoint, two conversations. One is that I'm not sure what Harrison has in mind on the committee structure later in this agenda, But we definitely should put together a group for the longer term, talking about how to tackle pandemic fatigue. And I'm thinking that it's not, here's how you recognize anxiety and stress and whatnot, but things that are positive that you could do about it. So I want to do that in concert, or if we do it, I'd do it in concert with the CHIP plan and all the other things that are going on. But I think the commission has a responsibility to minimally to seniors to one, have a Channel 79 panel that would also be on YouTube with Harrison and Dr. Gerber, number one. Number two, we should organize for the longer term, focused on happiness and pragmatic programs there. So those are my two recommendations.
This is Commissioner Russ Barksdale. Jim, I support all of your efforts that you've described. I'm very concerned with what it came across a little bit as an insensitivity to the impact that COVID has had on our community, and that we somehow feel that that impact is diminishing and has diminished.
Yeah, I don't agree with that.
COVID long is both emotional, mental health related, behavioral, healthy lifestyle related, all of those things. If anyone sat through the Board of Ed meeting, and I didn't, I just got second and third hand information, you know how passionate the parents were about their children. I think we all share that about the entire community. So we cannot fall into the resolution that COVID is over and it has diminished its impact on a very vulnerable population that we have. It is also important to note that there are more deaths under Omicron they were in the Delta. So mortality still exists, and anxieties are very high. And I think how people deal with not only vaccinations, but mask wearing and distancing and attending school and classes, as well as work environments, are extremely important. So I support Jim, I support the committee putting together a subcommittee to work on this issue. And I think long COVID is with us. We'll be transitioning between, if we haven't already, between a pandemic and an endemic, but COVID will be with us for a long time.
Actually, interesting point, Russ. In the Wall Street Journal article, they had 3 fundamental ways to tackle pandemic fatigue. And the first one was to accept that COVID is with us for a long time to come, and start planning your life around how to deal with that, rather than that it'll ever be eradicated, as it were. And the other thing, the post-COVID is a medical term primarily, people working on that to see what the, and there's a lot of science beginning to emerge about what the ramifications long-term of just having had it, even though you had it mild, you still got some issues that you're going to be dealing with potentially for the rest of your life. I'm thinking long COVID mental at this stage of the game is a place that the commission could get involved and have a role in the community, and with all these other activities going on. Not to duplicate any, but to, just as we did with the mind and body, create something that had standalone capability, not only for New Canaan, but Darien picked that up. AARP Connecticut picked it up and put it on their network also. So from the standpoint, there's we don't need probably a lot of time and effort spent against how to recognize stress, because I think everybody knows what that looks like and feels like. But anyway, so that's my recommendation. First is that we run a panel with Harrison and Dr. Gerber.
Question.
My question, oh, sorry, this goes maybe more to the ARPA funding.
Yes.
But I think there was a widely read op-ed in the New Canaanite this past week by Leo Carl. One of his suggestions, I think, is worth discussing, many of them, but the community behavioral health navigator, a paid position literally navigate this issue. And I would be curious to hear from Bethany, Marcy, and Jackie about what their thoughts are on that. They obviously have been handling a lot of the town mental health issues. And if there were someone to come in that was dedicated just to community behavioral health, what would that position look like, and what would their job responsibilities be?
All right, I'm going to try to tackle this. That is what Human Services does in terms of caseworkers and partnering and collaborating. If, as I said, if Waveney wanted to start being the center for the resources, possibly, I don't know what the plan would be. It's possible duplication, but on the other hand, depending on what that plan is, we could use it as a resource. So the mental behavioral health, there are so many speakers, and it's expensive. These speakers are a couple $1,000s, and then you have to pay for their traveling expenses, things like that. They're out there. We do not want to thin out the audience because there are so many speakers. That's one of the reasons for our grants, so that we can allow these organizations, these nonprofits in our area, we can partner with them and we can get the word out. In terms of what the commission, if they see it differently, in terms of how to access, we're totally open for Human Services for new ideas and new things, and we will add them to what we have. But the base we have is strong, it's collaborative, and hiring someone to do this, we're already doing it. You can tell by our reports, and I don't know what more that you'd want to add, and I'd be interested, and because we can add it. Behavioral health and mental health, they're interesting in terms of the nature. Each individual is different, and with HIPAA, the integrity, we have to stay on the non-medical side. We can only, how can someone benefit within the rights of the town's liability and the person's right for their free will, things like that. It's very complicated, but totally open, for ways to add to Human Services. In terms of hiring someone else to do it, I feel that we're more than capable of doing it with the workforce we have.
I of course, trust Barksdale again, Commissioner. I, of course, have to recuse myself for any discussion on ARPA funds and allocations. I will just say that was not, what was just explained was not Leo's suggestion to the town at all. Leo's suggestion, as I read it and as I understand it, is provide 24/7, 365-day access to some network that includes, of course, Health and Human Services, that includes all of these great programs that we have in services, but to do such in a collaborative way that someone could access any program, any service 24/7, 7 days a week, and have a number and a network to do that. Of course, it would be in collaboration of everyone, but I took away from Leo's report that he was looking at a more comprehensive of all of us working together. And for those crises that happen on a Friday night at 3 o'clock in the morning, how do we, really support our community? So I took it as just a different way of communicating and organizing everyone, not adding a person or hiring an individual, but more of a way to integrate all the great programs and to provide a single point of access, if you will, 24/7, 365.
Yeah, with the key point being your Waveney suggestion, as I understand it anyway, is for when Human Services and the health departments are closed. And you could have an alternative to EMT that maybe is a pre-screener, particularly for mental health. So I didn't see that as duplicating what Human Services and the Health Department do, but simply adding another resource.
Well, without knowing the plan, I would like, that's the thing, filling in these blanks. But in terms of a crisis, we do have, and this could be all part of it. So understand that I'm saying collaborative and community effort. This is what Human Services does. I'm not against what's happening or what's trying to be pushed for funding. We have 911. We have mobile crisis unit. We have Silver Hill, the police. I mean, this is how the community runs. So learning to call Waveney when there's a crisis, I don't know the liability of the town. That's what we pay 911 for. That's what the taxpayers, I feel like, are paying for that already. So I just need to understand what this plan is more clearly. Like I said, I feel like there's a lot of knowledge deficit on my part. But then again, is there really a plan, Russ, moving forward with this? Or is it just, if you get the money, we're going to figure out a plan?
Right.
Could I make a couple comments of listening
Yeah.
to this?
Because I'm knowledge deficit and I'd love to learn more, but it's very vague to me.
I'm not an expert in mental health issues. I have a personal bias in favor of creating a resource that you could go to when you have a problem, as opposed to creating productions for talking heads. Because I have a feeling the people who ought to watch those things don't watch them. And I had a question: what was the reach? How many people did we reach with the Let's Talk About It series?
Well, one of the issues was, and I'll just jump in here, Jim, was that there was a diminishing viewership with it progressively, which was not really supportive for those looking at numbers and wanting to continue that. I think we're running into a time issue here. I think the navigation topic is a large one. With the mental health, be it Waveney, whatever the other sources are, I have my own opinions on it. Don't forget, we have a cadre of physicians, psychiatrists, clinical social workers in private practice in town. One of the issues is, and this is what's beleaguers everyone, is that there's not enough of any of them in our community, nor state, nor country. And that's so to put someone into position to find the unfindable is, I mean, that's an extreme statement, but that's part of the issue here. Let's move on, because this segues into the mental health, et cetera, into the American Rescue Plan Act, and I'll move quickly through this. So there are meetings ongoing. Essentially, what the goal is to use the funding from the government to kind of replace the lost revenue of the nonprofits that have been negatively impacted by COVID. So that's number one. Silver Hill, as our first selectman did suggest a couple of meetings ago, discussing that and what they can do on an quote emergency psychiatric unquote problem area, and to establish something with them and support that. So that's part of what the mental health is. And as Marcy said, and Bethany, their experience with Silver Hill now is very good. They are very responsive, very competent, and it's great that we have that ongoing relationship with them. And that could be magnified in many areas, hopefully. So that is to be an ongoing discussion. And the plan was from the ARPA committee to explore that further with Dr. Gerber at Silver Hill and see what's available with that also. And also there was brief discussion about Waveney and some of their proposals, and there was a little discussion generated, but that was also shelved to, I think, more meetings with Russ Barksdale and the other people involved in that decision-making. So that was the American Rescue Plan Act. On to new business.
Before you go, Harrison, on the ARPA, I just want to give the commission a heads up that I'm going to be writing a letter to the editor in support of Leo Carl's letter and the Waveney plan. And the most important thing is that there's a healthcare jobs training operation that's part of the Waveney ARPA thing. That's the helpline mental health thing kind of got in the way of that discussion, but there's that and a expanded telehealth and telemental thing is also part of the Waveney ARPA plan. So don't be surprised when you read this, but it essentially will support what Leo Carl was laying out, but signed by a commissioner. Anybody
Okay.
who wants to join me is welcome for sure.
Thank you, Jim. On to new business, commission committee. So before I arrived, or when I arrived, and also prior to COVID, there were subcommittees, and I'm not sure to what extent they really functioned or did anything significant, at least in my brief exposure to them. So we did discontinue that. I did put on the agenda for, a year plus ago, commission. So any information coming from the various commission members, to give them a forum there, but that was not really productive and there was not much forthcoming. However, over the last month, with what's been going on in town, the comments at our last meeting about the availability or lack of it, or information to the public regarding COVID and mental health, and what's been going on somewhat with the Board of Education and in town, I felt there was probably a need to reinstitute that, if that's the word. So that's what we're going to do with our committees. I think at least on a trial basis over the next several months. So there'll be 3 committees. One will be health, and Jen will spearhead that. She'll be the point person. There'll be adults, and on that committee will be Bethany and I. On the adult and senior services, and the point person will be Marcy. We're going to have Jim Lisher and Tom Ferguson and Russ Barksdale. Thank you. And just, again, it's to get the pulse of the public. And I think we need to have our tentacles out amongst the people and produce some of these issues, or report them anyway and act on them if they're actable. And then the youth and family services, there'll be a committee with that too. And some of this functions too at present, but this will be Alicia Meyer and Alyssa McKenzie and Jen Laddick. And so let's try that. That's a source of community information, dealing with it at the different levels of how HHS functions. And we'll see whether that's more informative, helps us in our decision-making, et cetera. Last item on the agenda is masking. So I, at Lucy Datham's request, being referred to me by one of our commission members, she had questions. I did meet with her on Zoom about masking in town, Board of Education, et cetera. And I think, being a state representative of New Canaan and Norwalk, she's feeling some pressure in getting involved in the political side of the masking issue. The Jen Laddick also emailed me about having attended the Board of Ed meeting, and could HHS, people wonder where HHS stands with this or whatever. And we really haven't discussed this at length, so we're going to discuss it now. I have a number of bullet points, which I'll try to move through quickly. If we remember 2 years ago, there were masks, there were distancing, we were hand washing, we were surface washing, we were ventilating with HVAC or whatever, if possible. The hospitals were full, their ICUs were full. They were creating makeshift ICUs. There were, in New York, there were refrigerator trucks acting as morgues, and that's where that was. And then the vaccines came along, which was, the miracle of the century or whatever. And you think of where would we be without them? Anyway, masks were really our first line of defense, and now next to vaccines, they're our second line, but they're still important, and we know how they function. They filter the droplets, the aerosol from, and they do this with varying degrees of efficiency. And it's, I think if I remember correctly, the cloth masks are about 30 to 40% efficient. The surgical masks about 60 to 70, 70 to 80, somewhere in that neighborhood, 60 to 70, I think. And the N95s are just what they say, they're 95%. The fit and the time of exposure is always significant with this. And I think the government a couple of weeks ago sent out 500 million N95 masks. And I'm saying, well, why are they doing that now? Is with the Omicron, we know it's more contagious. So maybe that's it. Maybe those masks are actually needed and do a much better job with the Omicron. But it's also, they have at this point in time now, they have the PPEs, they have 500 million N95 masks. So they distributed to the public. Just an FYI, if you're uninfected and you're wearing a mask, you decrease the risk of getting COVID by about 67%. And if you're infected and you're wearing one, you decrease the risk to others of giving it of about 75%. And if you're both wearing it, there's about a 92% of decreased risk of getting sick with COVID. So these questions that Lucy Datham had and the Board of Ed, et cetera, they're dealing with children in the schools. So in children in Connecticut, about 20% of the COVID cases are children. 1% of the children who get sick with it are hospitalized. The mortality is almost 0%. It's 0.01% less. There's just, which is great. And in the USA, they've had, not quite 1,000, I would say 900 or so deaths with children. So it's as extremely rare as it is, it's not non-existent. The CEO of Yale Children's addressed a number of pediatricians last autumn, and they had reported at that point in time, there were about 200 children that had been hospitalized at Yale Children's with COVID, and they had 50 of them with the multi-system inflammatory disease of children, MISC, MIS-C. And in fact, supposedly now there are 2 children with that from our community at Yale. And there were 15 hospitalized with myocarditis, inflammation of the heart. Didn't differentiate whether it was secondary to the vaccine, which is a rare complication of the vaccine, most common in teen and young adult men, or whether it was disease related, which COVID also causes myocarditis. So we know that children not only get sick, but they transmit the virus, and transmission is much lower with mask mandates. So large study out of Duke, North Carolina, where they compared results there with other states and was very supportive of mask mandates when you looked at the statistics. So what do masks do? They keep the schools open, they decrease the illness, they decrease the hospitalizations. And generally speaking, masks are well tolerated. At New Canaan Public Schools, there's a handful of kids who are not masked, and they have very good reasons, special needs, et cetera. And but when you look at the total population of 4,000 students, that's pretty impressive. And parents are often concerned, those with asthma, with cystic fibrosis, whatever, that, in some way the mask is interfering with the mechanics of the ventilation, et cetera, which is not the case in the sedentary setting. And honestly, it's those children that you really want to be more protected from infection. In fact, everyone has observed over the last 1+ years with the use of masking that the incidence of a lot of these respiratory viruses, respiratory RSV or respiratory syncytial virus, and even the flu, commonly, it just wasn't hitting with the same numbers that it had prior to the masking. So, our numbers are down and significantly down, and which is great. And but they're not non-existent. And as the director of medicine said, we're not totally out of the woods yet. So Governor Lamont has his mask mandate in place until February 15th. I know there's a lot of discussion going on whether it's going to change or not. I think something came out yesterday where they may make this decision local as opposed to a statewide decision. And we'll see what happens with that. But Governor Lamont does not make these decisions in a vacuum or silo. I mean, he's got Yale Public Health people, UConn, he's got infectious disease people, he's got epidemiologists, and they all have input into the decision-making process. So we'll see where this goes. Anyway, those are my little bullets and open for discussion.
I guess one question, I don't know, again, Russ Barksdale. Harrison, do you have a chance to see the Board of Ed presentation at the last meeting at all?
I did not. No.
Okay. Is there, in your opinion, I know you're a renowned pediatrician in our community. Is your recommendation that after, given where our incident rates are in Omicron and even the Omicron variant, that after February 15th, the mask and should not be mandated?
I am a better safe than sorry person. The numbers right now are roughly the last 2 weeks. So the numbers of COVID positives in school over the last 6 weeks have decreased. I think the high was 147, something like that. And we're now down, the last 2 weeks, we're in the 30s category. We are, I'm as anxious as anyone to get this behind us. And I can appreciate the concern on parents, et cetera, with the masking. Not that it's that well-based scientifically, but there's, a discomfort, and no one would like, a lot of parents don't want to see their children masked. I think February there's going to be a school break in 2 weeks, and people will be traveling all over the country. They'll be going to various regions, north, south, west, and they will be exposed. And there's always a blip in the numbers when they come back from vacation. So if the numbers and the data has to dictate really what you do. When you drop the mask too, the numbers are going to go up. It's a given. To what extent are we safe enough now? TBD. So those are questions that are out there. I think that the data will give us numbers, and the governor will give us some decisions too. I would, I listen to, what's going on in the hospitals and what have you. Yes, numbers are down, but you have to be sensitive to the issue. And the whole other, we're beyond that point right now, but hospitals being, the one thing with Omicron being so contagious that it was depleting the staff at hospitals. So I wasn't wild about the CDC coming out with a 5-day deal, because that at 5 days, it's still, 15% are going to be contagious. But the hospitals were so appreciative of that 5-day because they could not staff their units. They couldn't staff the intensive care unit. They couldn't take care of all the COVID patients and everyone else that was in the hospital. So, there's a plus and minus to a lot of these things. So anyway, that's my answer, or my non-answer, whatever. I'm more on the conservative side.
Harrison, how does the current severity of Omicron compare to a bad flu year? In other words, that some people make that analogy. I don't know if it's valid. The original COVID was obviously a lot worse than flu. And given the high rate of vaccination in our community and the more mild version that we have now, how does it compare to the flu? Because with flu, we don't mask, we don't take a lot of precautions. Maybe we should, but we don't. How would you equate those, or do you have the data?
No, bad flus are bad flus, and they can be as significant as Omicron. 2009 H1N1 swine flu was very problematic. You know, I don't have the numbers to compare, but just having been, you know, affiliated with hospitals, I don't remember them saying that certainly not 52 people, like it was a little earlier in the year, were hospitalized with the flu. But, you know, the 24, which they had in the last week, that would not be surprising to have that number at Norwalk Hospital, say. And the intensive care units, you didn't really see that many with the flu, although if you're looking at only 6 in the last week, you know, it could have been when you consider age, and unfortunately, you know, pregnant women were very prone to have complicated flu scenarios like they do with COVID.
Yeah.
So, you know, they're both areas of concern.
When you said, Harrison, that the masking was well tolerated by almost all students currently, I'm under the impression, I don't have a child in school at this stage of the game, but I listen a lot, that the number of parents who want to unmask, as it were, is a relatively small number within the totality. And it based
Jim,
on
Jim, I think it's a pretty big percentage of parents want to unmask the kids.
they do.
Yeah.
I don't know. I have children. I have a child, and I have 3 children in school here in New Canaan, and
Yeah.
I think there's a very vocal
Yeah, but I
number
think-
of parents who want to unmask. I also think there's a lot of parents who realize the state of Connecticut, and in particular the town of New Canaan, has done a wonderful job of keeping our schools open when other places were not keeping their schools open. And they did that by masking, ventilation, and then when vaccines were available, being very proactive with vaccination. And it has worked, and we've kept our kids in school. I moved here from California. My friends in California didn't have their kids in school for an entire year.
Yeah.
We had our kids in school, and I'd love to keep them in school. We need to keep the schools open. The way to do that is to keep our numbers as low, keep doing what's been successful, keep our numbers as low as we can. Masking is a huge part of that, not forever, but like, you know, we've said, we're not out of the woods yet. As Jen said earlier, COVID ebbs and flows. There's already an Omicron 1B or whatever it's called. There's a new variant that's even more contagious. So I wouldn't mistake a very vocal contingent of parents for the majority of parents.
Right.
Well, I
That's
don't
my understanding.
know the number, how the numbers shake out among the parents. I don't think it's a 2% a vocal group, though. I think it's, and I don't know the number. I also, Alicia just very eloquently expressed the rationale for doing what we're doing. I'm not sure that has been articulated at the school meeting. I wasn't there. But if we drop the masks and we're at, you know, a significant risk of a big jump in transmission and infections, that would be really stupid. And so I think it would be good if we could shed some light on that question. And particularly if people are going to be traveling. There was a big jump in cases after the holidays, and could easily be another jump late February. So
Absolutely.
And if I could just add a little bit, Commissioner Alyssa McKenzie, my concern is that vocal, how large a minority it is, I'm not sure, that a lot of parents don't know that unmasking is on the table. And there's also a lot of individuals who cannot attend the Board of Education meetings because they're unvaccinated, unmasked people protesting those meetings. And so we don't really have a clear picture of where parents stand because it's just not equitable in terms of who is able to provide testimony publicly.
All right.
Well, I think that this goes to the point, and Chairman, we're getting close to our allotted time, and I think this goes to education, whatever we can do as commission to help educate as we move in this transition between a pandemic and an endemic, and when in mask, and maybe it's just the teacher wearing a mask and shield, and how we do that. I know it's not our decision. Our charter does not allow us to make that decision for the town. But I think that based upon all the technology and information that we have available to us from the hospitals and all the stats that we have, I think we can at least frame the discussion a little bit. And I think that would be helpful. That's number one. Number two, I hope we spend a little bit more time than we did on these committees, Harrison, that you read out and who was on what. I'm not sure we had a discussion on what their mission is. I just question, and my only concern is, again, we're talking about working collaboratively. That seems to go against that. And so I just want to know a little bit more information on what the charter or the vision is for each of these committees that you worked out. And having said that, I make a motion to adjourn, given the time.
I'll second. All in favor?
Okay.
Thank you so much for attending and also participating, and appreciate all your thoughts and comments.
Thank you.
Have a great, healthy month.
Yeah.
And we
All right,
we'll be meeting again on March 3rd, and we'll decide then whether it's Zooming or in person. Thank you.
Okay, the recording will end right now. Thank you, everybody.
Thank you.